You're looking at a computerized picture of the brain. It was taken without the use of surgery, without intruding into the body, without causing pain to the patient. This camera, called SPECT, has made it possible to show clear and more complex pictures of the master organ of the body, the brain.
Consider the brain as a kind of biological computer, a vast network of tens of billions of neurons, nerve cells that communicate in a code of electrical impulses that control everything we say and do. I'm Allison Field.
And I'm Frank Field. Here's a chance to use your brain to answer questions about strokes, dyslexia, Parkinson's disease, Alzheimer's disease, and many other brain-related problems. And it's all coming your way on the Brain Test.
We now return to Discovery Field Test.
Schizophrenia is a profound psychiatric disease that affects thinking, emotions, and the ability to function over an extended period of time. Question: how many people in the United States suffer with schizophrenia? Is it about 100,000? Over 2 million? Or do you think it's over 5 million?
Well, I think schizophrenia is a cultural condition and it may not exist at all in reality.
5 million, because in Holland we got the same and you hear a lot about it.
I would say over 1 million. I think it's a pretty big problem.
The answer: over 2 million people in the United States suffer with schizophrenia.
Schizophrenia affects an enormous number of people in this country. Not only the patients, but the families suffer from it. The disease is ravaging and makes people who have been successful and effective often converted to just people who can't do very much. One of the nice things, however, is that we have distinct hope. The federal government is placing more money into research on schizophrenia. Money is also coming from the private sector. And we have some interesting leads in research. We have the possibility of a genetic factor which may be playing a role in schizophrenia. We have the possibility of understanding certain substances in the brain which may have an effect in bringing about schizophrenia. We are hopeful that in the next decade, this ravaging disease may actually relent somewhat and respond to scientific advance.
You've seen the pictures. Young people injecting drugs into their arms, popping pills, smoking marijuana. Once addicted, it becomes difficult to stop. Some substance abuse drugs go directly to the brain and cause an instant reaction. Our question: which drug affects the brain fastest? Is it heroin, crack, cocaine, or marijuana?
Well, I think it's crack because it's a chemical drug.
Cocaine, it rushes right to the brain as soon as you inhale it.
The answer is crack affects the brain the fastest.
That's true. Crack is the fastest. But that can be misleading because all substances of abuse, in fact, affect the brain and can cause significant health consequences. Marijuana, which is sometimes considered the softest drug, can be stored in the body for up to 30 days and have long-term effects on the nervous system. It's important to remember that all of these drugs and alcohol can also cross the placental barrier and affect the unborn child.
Reading. Normally a simple learning process, fun and educational for most youngsters, but not if a sentence like this looks like this. Now that's the way the sentence might read if someone suffering with dyslexia looked at it. Our question: is dyslexia related to intelligence? What do you think? Yes or no?
No, it's not. Because most cases when you have somebody who's dyslexic, proper teaching can provide them with the proper knowledge to perform well at any skill.
Not at all. Dyslexia is a learning disability, and you can be very intelligent and have a slight case of dyslexia.
Yes, I believe so. I believe people who have dyslexia disease are not as fast as those people or individuals who do not have that disease.
Well, the correct answer is no.
Many intelligent and extremely creative individuals have had dyslexia, including Thomas Edison, Albert Einstein, and probably Winston Churchill. What is important is that dyslexia is caught early. In my case, dyslexia wasn't really known when I was a child, and I had great difficulty reading, specifically when I was asked to read out loud. Today, where we know dyslexia exists and we know how to circumvent some of the problems, it's important that any parent who feels their child is having a reading difficulty seek the advice of their pediatrician and educational specialists who are present in many school systems.
The fastest growing population segment in this country is the senior citizen. By the year 2000, approximately 1/2 of the elderly will be over the age of 75. It's a positive situation, but it does have some problems and challenges. Our question, true or false? If you live long enough, there's a good chance you'll become senile. What do you think? Is that true or false?
It's false, because I know lots of people who are quite old and they're not senile.
Absolutely true. Very common. Alzheimer's disease, all of that. Absolutely. I have no doubt of that.
I think when somebody gets older, they forget and they start talking about things in the past, and I think it's true.
The answer is false.
Many people think that senility is inevitable. But the fact of the matter is that 80 to 85% of elderly individuals do not suffer degenerative brain conditions. Sometimes people will think that they're becoming forgetful and senile, but forgetfulness is in fact a normal part of aging. It's seen in humans and in animals. Today, with our increased technological capabilities, we can better appreciate the differences between normal forgetfulness and degenerative senile changes. Here, for example, is a PET scan which shows on the top a normal elderly control, and below which is a typical Alzheimer patient. One can readily appreciate the differences between these two individuals.
Doctors call it a CVA, a cerebrovascular accident. It describes a condition when the flow of the blood to the brain is disrupted. Now, we know it as a stroke. Doctors are often asked, what's the difference between a stroke and a heart attack? Well, in a heart attack, a clot cuts off blood to the heart. In a stroke, a blood clot blocks the blood going to the brain. So our question is this: how common is this stroke? In a year, how many people do you think suffer a stroke? Is it 1 to 200,000 people? Is it 3 to 400,000? Or do you think it's 5 to 600,000 people?
I think it's 5 to 600,000 because I've been reading about this becoming much more common. Given the choices, I would say it would be in the 3 to 400,000 range.
3 to 400,000.
The answer, according to the National Stroke Association, is approximately 5 to 600,000 people every year.
Unfortunately, that number is correct. Stroke is the leading cause of adult disability in this country. This medical event is most common in people over the age of 65, but it can happen to anyone at any time. About 2/3 of those who suffer a stroke will survive, and about 1/3 of this number will recover to the point that they can resume normal activities. There are certain risk factors which we should be aware of to help reduce the incidence of stroke. Hypertension, having had a previous stroke, heart disease, diabetes, smoking, being overweight, excessive use of alcohol.
Muhammad Ali made news when he considered a brain tissue implant to improve his Parkinson's disease condition. The disease causes loss of muscle control, tremors, slurred speech, and the inability to perform everyday tasks. Our question, true or false? Elderly people who develop tremors usually develop Parkinson's disease.
I think that tremors are to do with your nervous system, not necessarily related with your brain.
I think that's true. I think because your body breaks down the older you get, and that's one of the hazards of getting really old.
The answer is false.
Most elderly people with tremors do not have Parkinson's disease. Parkinson's disease, when it occurs, is associated with other symptoms that can be readily recognized by a physician. Current treatment of the disease is the use of L-DOPA, which alleviates many of the symptoms of the disease but does not cure it. Recently, there has been work in the possibility of using an experimental drug, Depranyl and vitamin E, to slow the progression of the disease. This work is just in its infancy.
Playing the guitar or any musical instrument requires coordination between the brain and the fingers. Which side of the brain do you think dominates activities like music, art, or math? The right side or the left side?
I believe it to be the left side of the brain. I think there has been famous drawings even about the left side of the brain and how it sort of dominates it.
The answer is the right side.
Patients who have right-sided brain damage may have major difficulty with spatial orientation in the left side of their body and the left side of their world. They may have major difficulties understanding what is going on in the left side of their body. However, more devastating for a patient with stroke is damage to the left side of the brain, which frequently produces considerable difficulty in understanding the spoken word and producing speech correctly. This problem spills over into understanding the written word and the patient's ability to read.
We'll be back with more questions on the brain test in a moment.
Remember how many questions we've asked thus far. Well, how do you remember things? To tell you the truth, scientists don't really know how the brain takes in information, stores it, and then lets you bring it to mind when you want it. Alzheimer's disease, which is characterized by a slow degeneration of the brain, affects between 2.5 and 3 million people, and it kills about 100,000 Americans every year. Well, many individuals are concerned when a close relative has Alzheimer's. The fear is that the disease will strike them as well. So, if a parent has a proven case of Alzheimer's disease by the age of 45, how likely is it that the child will get it? Is it 10 to 20%, 40 to 50%, or is it 70 to 80%?
I would say 40 to 50% because I think it's also genetic.
10 to 20. I think it would be highly unlikely that another member of the family would get it.
10 to 20%. Because people in my experience that I have known that have had other members of the family get it haven't gotten it themselves.
The answer is 40 to 50%, almost half.
If a parent has Alzheimer's disease by the age of 45 or 50, the likelihood of a child developing that disease by age 85 is up to 40 or 50%. Not all forgetfulness, however, is pathological. Forgetting names, telephone numbers, even why you walked into a room or searching for words may simply be the sign of normal aging and or a very busy mind. There are other illnesses such as thyroid disease, alcohol intake, drug intake, even prescription drugs, or any illness that causes infection, inflammation, or pressure on the brain that can cause forgetfulness. Careful search for and treatment of these illnesses can eliminate them, halt them, or even cure them, so that the diagnosis of Alzheimer's disease is unacceptable until these diagnoses are made or ruled out.
And now doctors are investigating the use of promising new drugs, such as spectamine, to diagnose Alzheimer's and other diseases of the brain. Easy to understand how the brain actually works, how it operates, how does it remember, how does it actually think. And when the brain malfunctions, how do you treat the disorders of the brain? Schizophrenia, multiple sclerosis, Alzheimer's, Parkinson's, and so many other diseases. Well, here's our test question. When a drug is given to a patient suffering from a brain dysfunction, how much of that drug actually gets into the brain? Is it approximately 10%, 25%, or 50% or more?
Probably 10% of the pill goes into the brain. The rest is dissipated through the blood system as a waste material.
The higher number, 50, because alcohol gets to the brain fast, so the drug should obviously get to the brain fast.
The answer, approximately 10% of the drug intended for the brain actually enters the brain.
Yes, approximately 10%. And that's as a consequence of a barrier that exists between capillaries which surround the brain and brain tissue. This barrier is referred to as the blood-brain barrier. The blood-brain barrier plays a critical role, namely it protects the brain from sudden influxes of chemical or electrical stimulation. However, there is another side of this blood-brain barrier, namely it excludes potential therapeutic agents which might be useful in the treatment of diseases such as Parkinson's disease, Alzheimer's, or even dementia. Hopefully, in the near future, we will be able to develop drugs that are capable of traversing this blood-brain barrier.
Sometimes problems become too difficult for an individual to handle, and he or she feels that the only way to solve the difficulty is to commit suicide. Our question: most teenagers who commit suicide usually do not show any dramatic problem prior to the attempt. Is that true or false?
I think that is false. I think that most teenagers do reach out for help to the people closest around them.
I think some will and some won't.
I had some friends of mine's children, one of them committed suicide. They didn't know anything about it until it happened.
Most people think the answer is true, but it isn't. The answer is false.
In fact, most teenagers who commit suicide have a substantial psychiatric problem. They may have a depression. They may be involved with alcohol or drugs. There are some who may be schizophrenic. There are some who are so perfectionistic that the slightest imperfection causes enormous stress in them. Parents should take note of teenagers who show profound changes. If they seem to have no pleasure in anything in their life, if they suffer an enormous setback in school or in their personal relationships and seem to be very depressed as a result of that setback, if they are preoccupied with suicide, these kinds of signs are worthy of attention. When you see them, try to talk to your son or daughter. If you can't, try to have a brother, a sister, a cousin, a friend, anybody whom you think has a close enough relationship so they can talk to them comfortably and perhaps draw them out. The main thing is to not let these signs go unattended.
When was the last time you came out of a store in a shopping mall and simply couldn't remember where you parked your car? Are you the kind of a person who forgets someone's name a moment after you meet him? Here's the question. Is poor memory often a symptom of depression? What do you think, yes or no?
I don't think so. I don't have the greatest memory and I'm not depressed.
The answer is yes. It is often a symptom of depression.
Depression can affect memory profoundly, and in fact, many patients will talk about when they're severely depressed as if their brain is dead. And this is a very important distinction to make, because in an elderly person, the physician may mistake a depression for dementia and give the sense that nothing much they can do. Indeed, in the case of memory problems that come from depression, there's a lot you can do, because the treatment of depression will clear up the memory problem, and we know that treatments for depression work about 75% of the time.
We'll be back with more questions on the brain test in a moment. Here's our next question. True or false? A stroke usually occurs without warning.
The answer is generally false, but enough patients do have warning symptoms suggestive of stroke that they become an important issue for the patient to take to his physician. The common symptoms suggesting stroke are loss of vision transiently in one or both eyes, weakness or loss of sensation on one side of the body, transient inability to understand or to produce the spoken word, and occasionally loss of strength in both legs and vertigo. These symptoms are important. They should not be ignored. They should prompt the patient to go to a physician, consult him about treatment which may prevent a disastrous stroke.
Because it could hit anybody. It hit me. I never expected to get a stroke. And you look back with hindsight, I had two small signs of something wrong. I didn't know it was leading to a stroke, and I went to a doctor, and he gave me whatever medication he could give me, and I got the stroke anyhow. I had two blackouts of my right eye. I couldn't see for a matter of seconds on two different occasions. And now they go back and say, that was a sign. But something like that, other people have little blackouts, and every sign doesn't mean you're going to have a stroke. I mean, but that's how my case was anyhow.
Well, hopefully the secrets of the brain will soon be uncovered, and scientists will solve some of the problems that affect the brain. Diseases like Alzheimer's and Parkinson's, and so many others will one day just be a memory, recorded by the brain.
Every day, scientists are learning more about which brain chemicals produce different effects and are working to create drugs that can do the same thing. I'm Allison Field.
And I'm Frank Field.